Before we begin, I want to ask you a very important question. If I could look at your hands right now, would I see a warning sign that your heart is trying to send you? Most people over 60 think heart disease announces itself with chest pain, shortness of breath, or a trip to the emergency room. But after caring for older adults for decades, I've learned something surprising. Sometimes the earliest clues appear months or even years before a major cardiac event, and many of those clues can be found in your own hands. In fact, one of my patients, a 72-year-old gentleman, came to see me because he felt perfectly fine. No chest pain. No dizziness. No alarming symptoms. His only complaint was that opening a jar had become strangely difficult. He assumed it was simply aging. 6 months later, he suffered a serious heart attack. Looking back, the warning signs had been there all along. That's why today's video could be one of the most important health videos you watch this year. I'm going to show you 6 hand-related warning signs that may reveal hidden problems involving your heart, circulation, blood sugar, cholesterol, and overall longevity. And make sure you stay until the very end because the final sign is often dismissed as normal aging, yet it may reveal a hidden condition that places enormous stress on the heart. Before we continue, take 2 seconds to help us reach more seniors. Subscribe to Healthy Wisdom for Seniors and turn on notifications. Every week we share practical health information designed to help you stay independent, active, and healthy for years to come. Now let's begin with what may be the most powerful predictor on today's list. Sign number 1, weakening grip strength. I want you to do something with me right now. Imagine the last time you opened a tight jar lid, carried heavy grocery bags, lifted a suitcase, or shook someone's hand. Did those tasks feel more difficult than they did 5 years ago? Research involving hundreds of thousands of people has found that grip strength is much more than a measure of hand power. It may actually reflect the overall condition of your body. Scientists discovered that people with weaker grip strength often face a greater risk of heart disease, stroke, and premature death. Some experts even consider grip strength one of the most valuable indicators of healthy aging. But because your grip depends on far more than your hands. It depends on healthy muscles, healthy nerves, healthy blood vessels, adequate circulation, proper hormone balance, and a cardiovascular system capable of supplying oxygen throughout the body. Think of grip strength as the canary in the coal mine. When the body's systems begin losing efficiency, grip strength often declines before more obvious symptoms appear. Here's a simple test. Hold a gallon of milk. Carry a moderately heavy shopping bag. Open a stubborn jar lid. If tasks that once felt easy now seem challenging, your body may be asking for attention. Now, I want you to participate. In the comments below, type strong if you can still easily open a jar, or weaker if you've noticed a decline in hand strength. I read as many comments as possible, and your answer may encourage someone else to pay attention to their health. Now let's move to sign number 2, and this one surprises almost everyone. Your fingernails may be telling a story about your heart. Most people look at their nails only when trimming them. But physicians often examine fingernails because they can reveal valuable information about oxygen delivery and circulation. Healthy nail beds are usually pink. That pink color comes from oxygen-rich blood flowing through tiny vessels beneath the nail. But when something changes, your nails may change too. Some people develop unusually pale nail beds. Others notice a bluish tint. Some experience dramatic changes in nail shape. One particular change is called clubbing. This occurs when the fingertips gradually enlarge and the nails curve downward more than normal. The change usually develops slowly, making it easy to miss. Yet clubbing has long been associated with conditions affecting oxygen delivery, including certain heart and lung disorders. Here's a quick self-check. Place the same fingers from each hand against one another so the nails touch. Do you see a small diamond-shaped space between the nails? Normally you should. If that space disappears completely, it may be worth mentioning to your healthcare provider. Now, before anyone panics, remember that nail changes do not automatically mean heart disease. But they are clues, and clues matter. The earlier we recognize patterns, the more opportunities we have to prevent serious problems later. Which brings us to sign number 3, a hidden issue affecting millions of adults over 60, elevated blood sugar. Many people think blood sugar is only relevant if you have diabetes. That is a dangerous misconception. Long before someone is diagnosed with diabetes, elevated glucose levels can quietly damage blood vessels throughout the body. Imagine pouring a sticky substance through delicate plumbing every day for years. Over time, damage accumulates. Blood vessels become less flexible. Inflammation increases. The risk of cardiovascular disease rises. Here's the frightening part. Many people have no symptoms at all during the early stages. They feel normal. They look normal. Yet inside their arteries, damage may already be occurring. This is why some doctors compare the body to an aquarium. You can provide excellent food and care, but if the water itself becomes toxic, everything inside begins to suffer. In the same way, an unhealthy internal environment can undermine nearly every aspect of health, including the heart. If you haven't checked your blood sugar recently, especially your A1C level, this may be one of the most important conversations you have with your doctor this year. And what I'm about to reveal next may shock you even more because it involves a small change on the back of your hand that many people never notice until it's too late. What I'm about to reveal next may shock you even more because it involves a small change on the back of your hand that many people never notice until it's too late. Sign number 4, yellow bumps or deposits around the tendons of the hands. If you've ever noticed small yellowish lumps near your knuckles, fingers, or tendons, don't ignore them. While there can be several explanations, in some cases these deposits are associated with elevated cholesterol levels and inherited lipid disorders that significantly increase cardiovascular risk. Think about it this way. If excess cholesterol is building up where you can see it, what might be happening in places you cannot see, such as the arteries supplying blood to your heart and brain? This is why many experts encourage looking beyond a basic cholesterol number. Two people can have similar cholesterol levels yet very different cardiovascular risk profiles. Some individuals carry a greater number of small, dense cholesterol particles, which may be more likely to contribute to plaque formation inside arteries. The scary reality is that plaque can silently accumulate for years without causing symptoms. Then one day, a blood clot forms, blood flow stops, and what seemed like a normal day suddenly becomes a medical emergency. This is why prevention matters so much. The best time to address cardiovascular risk is before symptoms appear, not after. Now let me ask you something. When was the last time you had a complete discussion with your doctor about your cardiovascular risk? Not just your cholesterol. Not just your blood pressure. Your overall risk. If it's been years, consider making it a priority. Now let's move to sign number 5, a symptom that causes anxiety in millions of older adults. Hand tremors. Have you ever looked down at your hand and noticed a slight shake while holding a cup of coffee, signing your name, or reading your phone? Many people immediately fear Parkinson's disease or assume they're simply getting older. But sometimes the explanation may involve a completely different organ, the thyroid gland. Your thyroid acts like the body's metabolic thermostat. When it becomes overactive, every system begins running faster. Your heart beats harder. Your pulse may become rapid. Anxiety increases. Sleep suffers. Weight loss may occur unexpectedly. And one of the most common signs can be trembling hands. In some cases, individuals spend months worrying about their heart when the true issue begins with thyroid hormones. This is why comprehensive health evaluations are so important. The body functions as an interconnected system. A problem in one area often creates symptoms somewhere else. The goal is not to jump to conclusions. The goal is to recognize patterns. And that brings us to our final warning sign, the one I asked you to stay for because it is incredibly common and frequently misunderstood. Cold hands. Have you ever noticed your hands feel cold even when everyone else seems comfortable? Maybe family members joke about it. Maybe you've accepted it as part of getting older. But here's what many people don't realize. While cold hands can sometimes result from normal sensitivity to temperature, persistent coldness may occasionally reflect issues involving circulation, blood vessels, thyroid function, anemia, or the body's stress response system. Your autonomic nervous system constantly adjusts blood flow throughout the body. During periods of chronic stress, blood vessels in the hands can narrow, reducing warmth and making your fingers feel cold. In other cases, underlying vascular disease may be limiting blood flow. This is why context matters. One symptom rarely tells the whole story, but multiple symptoms occurring together may reveal an important pattern. Imagine someone with cold hands, reduced grip strength, elevated blood sugar, and poor exercise tolerance. Each symptom alone may seem insignificant. Together, they tell a much different story. And that leads to one of the most important lessons I want you to remember from today's video. Your body whispers before it screams. Major health events rarely appear without warning. More often, subtle clues emerge months or years beforehand. The challenge is learning to recognize them. Before we finish, I want to share 4 health measurements that every adult over 60 should know. First, your grip strength. Research has found that lower grip strength is associated with higher risks of cardiovascular events and mortality in many populations, making it a surprisingly useful marker of overall health. Second, your resting heart rate. Third, your A1C level, which reflects your average blood sugar over the previous few months. And fourth, your fasting insulin level, which may provide early clues about metabolic health before diabetes develops. These numbers cannot predict the future, but they can provide valuable information about how your body is aging and where you may need to focus your attention. Remember, healthy aging is not about luck. It is about awareness. It is about catching problems early. It is about taking action while you still have options. If today's video helped you, please subscribe to Healthy Wisdom for Seniors, give this video a thumbs up, and share it with someone you care about. Every subscription helps us continue bringing trusted health information to seniors around the world. And before you leave, I'd love to hear from you. Which of these signs surprised you the most? Have you noticed weaker grip strength, nail changes, tremors, or cold hands? Let us know in the comments below. Your story may help another viewer recognize a warning sign they have been ignoring. Thank you for spending these minutes with us today. Take care of your heart. Listen to what your body is telling you, and remember, the small signs you notice today could make a life-changing difference tomorrow.